Hi, everyone. My name is Jody White, and I would like to ask everybody if they could please mute their mics for the presentation. Today, we are going to be talking about breaking the cycle, supporting services for victims of domestic violence. Today's agenda, we're going to be talking about the program history, funding overview, program challenges, key opportunities, visions for our future, how to support these programs, and of course, open discussion. Let me introduce you to the CCS team. So we have Evita Mendez-Counts. She is our executive director for CCS Yuma, and her contact information is posted. We have Mary McClendon. She's our agency director for CCS Yuma. And my name again is Jody White, and I'm the regional director of domestic violence programs, and my contact information is listed. Program history. So in 1983, CCS established our first domestic violence shelters. We established shelters in Yuma County. That shelter is Safe House. Porgash House and House of Hope are in Cochise County. One is in Sierra Vista and the other is in Douglas. In 2017, CCS began providing mobile community-based advocacy. Prior to that, we had done the service, but we were not being reimbursed for that service. So in 2017, we really began the push to provide services to victims in our communities that didn't need shelter services. 2019, super excited to announce that we started housing. Housing has always been a passion of mine, and I know that it is a passion of CCS, that everybody have safe, affordable homes to live in. And we started our first programs with Yuma County CDBG funds so that we could have housing for those transitioning out of our shelter. And then in 2022, we established housing programs in Cochise County. Super excited to get that started. Population served. We serve victims, survivors, both men and women and their children that have experienced domestic violence, sexual assault, child abuse, elder abuse, and human trafficking. I'll tell you a little about our staff and volunteers. We have domestic violence lay legal advocates. In Yuma, we have one lead advocate, and we have 3 case manager advocates. Cochise, we have one program coordinator and 2 advocate case managers that provide those services. We also have program aid staff. They're available 24/7. They provide daily operations, program screening, resources, and community referrals. Services provided in shelter. I'm going to elaborate a little bit on these slides. So emergency shelter services provide a safe haven for those fleeing domestic violence for their safety. So we are emergency shelter services for victims. Advocacy services for court accompaniment and orders of protection. Oftentimes people come in and they need that safety. They need that order of protection for themselves or their family members, but not everyone uses that service. So we offer the service and we offer the guidance if the victim chooses to use those services. We provide all basic needs. We provide food, clothing, personal hygiene, and transportation. Oftentimes, victims come to us with just the clothing on their backs. Their children don't have their backpacks. They don't have their school supplies. They may not have the medication that they need. So all of those things we are able to provide. There is a picture on the slide of our linen closet, I guess you would say. And there's also a picture on the bottom where it is the kitchen, where our staff actually prepare all the meals for all the clients who reside in shelter. Victims and their children can reside up to 120 days in emergency shelter services. And many of those victims do stay the full 120 days, and then they exit into our housing programs. We offer a crisis hotline, personal advocacy, case management, support for self-sufficiency, legal advocacy, and other supportive services such as that transportation and referrals to community services. And before we leave that slide, if we could go back just one moment, I wanted to say that crisis hotline is monitored 24 hours a day. We get calls on that crisis hotline sometimes because someone just needs a voice to listen on the other end. Oftentimes people will call us just to say they're struggling, but they don't need housing. They don't need emergency shelter. They just need an ear to listen. And our advocates and program aides can be that ear and can be that person just to get them through that time that they're going through. We can provide resources such as another helpline, a suicide prevention hotline. We can provide community resources. And sometimes just listening to someone is all they may need. Services provided in mobile and community-based advocacy. Those look so broad because we can meet a victim where they're at. They don't necessarily have to come to an office. We can go to them. We can meet them at a safe place, the library. Maybe they want to meet at a park so that their children can run and play and their children don't have to listen to necessarily the story that brought them to us for that day. We provide advocacy services and court accompaniment and orders of protection. And sometimes the law library or the courthouse calls us and we go and meet a victim that might be wanting to research or to learn different things about what it looks like to have an order of protection. And so we can leave and meet them at the courthouse. Safety planning. It might sound unique to some, but to us, it's very important. Everybody's safety plan looks a little different. We want a safety plan so that in the event that an abuser or a perpetrator finds the victim, the survivor, outside of the safety of the shelter, that they can learn what to do. Drive to the police department, contact a friend, use a safety word so that if they call someone and they use a safety word, then that person knows what to do next. We also safety plan with the children, so children know how to provide safety for themselves and their mother or their father. Believe it or not, we safety plan for pets because oftentimes an abuser will use a pet against a victim. So we want to make sure that everybody in that circle is protected. Case management services for support and self-sufficiency. Our end goal is always going to be so that family, that victim, that survivor has self-sufficiency, a new job, a place to live, transportation, all the things that sometimes we take for granted that they don't have. So we want to make sure that they're self-sufficient when they finish our programs. And when I say finish, that might be 3 years down the road, that might be 5 years down the road. There's no time limit on how long we can provide mobile and community advocacy to someone once they've come into our program. Oftentimes, we're even invited to graduations, to events for family members, because their family, their children got to know us so well, and they felt comfortable letting us know their accomplishments as they transition out of being a victim out of being a victim and into a survivor. Educational and activity groups, very important. Not everybody wants to go to a group setting, and I understand, but they're there. We're there to provide them education on basic things, whether they need to enroll in SNAP benefits. Maybe it's WIC. Maybe they need help with budgeting. Maybe they need help with writing a resume, getting a new job. So our educational groups are like kind of individualized for them, but for all. Anyone could jump into a group if they wanted to learn something new. Today, our activity group, because we were doing a big back to school kickoff, so in one of our shelters, we are actually taking victims and their families to the movies. And so everybody was super excited to get ready for that activity group. Referrals and resources within the community. So we work with all of our community partners, and any referral resource that we have, we want to pass on. And the Yuma community, we just had back to school haircuts free. And so we let everyone know, we helped them enroll so that they could get their kiddos back to school haircuts at no cost to them. So that was super fun. Outreach and community education on domestic violence services CCS provides. So we always want to let everyone know if we're doing an outreach event. And up on the picture on the screen, we did a no more domestic violence in one of our border communities. We do a walk every year, and we do a dinner every year for victims through Victim Services. And we try to encourage all of our victims and survivors to attend these so that they can get more information within the community and so that their voice can be heard. Housing. So this was my passion. I'm so excited to see housing. As you can see on the picture, we had our first duplex that was built here in Yuma. And we also had one of our board members, our priest, Father Emilio, came and blessed the houses before victims and families moved into these houses. And you'll also see in the picture that one of our board members is a local police officer. And so we were super excited that the board was able to be part of that and see just what it is that we here in Yuma, Sierra Vista, and Douglas can offer people who have that self-sufficiency so that they can live in beautiful homes and be safe, and so they can continue to thrive. So the services we provide is assistance with locating and securing safe, affordable housing options. So it might not be one of the houses we own. It might be something where they take a rental coupon or voucher and they go find their own unit. And we do go in to make sure that the unit passes all guidelines that are set forth by the counties to make sure that they're safe and that everything works properly within the unit. Financial assistance in securing housing, and also ongoing rental subsidy for up to a year. And that is through our tenant-based rental assistance program and also day one funds. Case management services for support and self-sufficiency to build on those skills so they can thrive long-term. So everyone in housing has a case manager advocate assigned to them. And that case manager and advocate go to the unit at a minimum of one time per month to check in, to ask if they need anything, to provide referrals or resources. Maybe their hours at work have been cut and they need a little extra. So we might assist them with a food box. We might assist them with personal care hygiene items, whatever that looks like for the family. Referrals and resources within the community. Again, we just kind of spoke about that. We are able to provide that to someone who is in housing, or maybe someone who's about to transition out of our housing and into more permanent housing. Maybe they just received their HUD voucher. And so we're going to help them with that transition to more permanent housing. Again, we touch on that education on community events and activities. We want the families to be strong. We want them to know what is in their community that will help them and help their families, whether it's a free event at a park, whether it's those back to school haircuts, maybe it's a back to school backpack drive. We want to make sure that they have all the education and can have those resources. Also, we continue with ongoing support for that judicial system process. So sometimes people's cases take time through the court systems. And so we want to make sure that if a case is in the process, that we continue to provide the support. We can continue going to the hearings with them. We can help them understand, maybe help them write a victim impact statement. So the staff will continue through all of those processes. Program funding, that's not the fun part, but we will talk about it. So our primary funding source is through Department of Economic Security and VOCA, the Victims of Crime Act. And throughout the last few years, we have not been getting great raises, I guess you would say. We are kind of receiving funds that we received 3 and 4 years ago, but we're still going strong. We are still looking for other options. And we also have support from Western Arizona Council of Government, the SSBG funds. We receive funds through Arizona Bar Foundation, which is the Domestic Violence Legal Assistance Program. We receive small amount of funds from the city of Yuma, small amount of funds from CACFP, which is a child food program, and contributions. We rely heavily on contributions to fill in on the things that the grants don't necessarily purchase or fund fully. Just a little fact, the cost of domestic violence exceeds $8.3 billion per year in the United States. And that encompasses emergency response, shelter, court, probation, medical expenses, property damage, or property loss. Between 21 and 60% of domestic violence survivors lose their job due to reasons stemming from abuse. By supporting domestic violence programs and domestic violence housing, we have a positive impact on education, productivity, healthcare costs, and criminal justice costs. Current challenges. Funding. The current trend in funding levels and anticipated budget cuts from the state of Arizona are impacting the rate of inflation and labor costs that have occurred since the pandemic. I want you to look at the pictures. Every year we try to take all the victims in the shelters and we take them back to school shopping. Everybody wants a new pair of shoes to start the new year, and everybody wants a new backpack. So we are able to provide those things with some of our donations that we receive throughout the community. And we've already started that for this year, and the families are very, very excited. Also on the picture, you'll see that we were able to bring some activities to the shelters. We had an amazing dinosaur exhibit, and the kids absolutely loved the actual animated dinosaurs. You'll see a picture there of a staff member. You get to see the joy on her face. She had so much fun. She might have had more fun than the kids, to be honest with you. We want to minimize cost without jeopardizing goals and objectives and safety of the participants when we're talking about those shortfalls. So that's why we will continue to look for other funding sources. We're going to talk a little bit about space and availability. We do have limited space due to our family sizes, family demographics, or physical limitations at times. We are a 10-bed shelter in Yuma, a 10-bedroom shelter in Yuma, a 9-bedroom shelter in Sierra Vista, and a 5-bedroom shelter in Douglas. But sometimes our family sizes make it difficult to serve 10 families, 9 families, and 5 families. We also have to accommodate pets, and that can sometimes be a challenge. And we also always have to make sure that we're maintaining the ratio of staff for the safety of the clients. Key opportunities and our program vision. Lead and support the change in families by breaking the cycle of domestic violence to reduce future trauma and cultivate healthy and prosperous community. Key opportunities. Number 1, new partnerships. We want to increase marketing and outreach within the social service field, including, but not limited to, other agencies, mental health providers, doctors' offices, and our local hospitals. Number 2, we want to increase educational outreach. Relationships with key media outlets provide opportunities to educate the community on current domestic violence, prevention, intervention, and available services. Number 3, increase partnerships with social service clubs. Build on existing partnerships with local clubs to increase volunteerism and local fundraising events. How can you support? There's always board and community opportunities, policy advocacy, outreach to local and state elected officials regarding the importance of funding domestic violence programs, their education, and shelter services. Donations. Monetary donations to fill the gaps of funding sources. Program supplies are always helpful. We always can use personal care products, new clothing, bedding, and diapers. We see a lot of kiddos in diapers, and that is a big expense to our bottom line budget. You'll see over on the picture quickly where we had this last Christmas, some Christmas events. So we had a Santa Claus come in and provide gifts to the kiddos. And we also had the Grinch come in and read stories to our clients and their kiddos. It was an amazing event. Everybody loved it. So I wanted to showcase those pictures. But other than that, other supports is just education, right? We want people to know that oftentimes people see domestic violence as a taboo topic. It's characterized generally by silence. This silence affects more than just the victim. It affects those children, the family members, and it allows the abuser to continue that cycle of abuse. Together, we can join to empower survivors to break the cycle of domestic violence. That's the end of my slideshow. I certainly have time for open discussion, questions.
This is Laura. I have a question. How long can they be in a transitional housing before they can get their own place in that second step?
Our transitional housing is 1 year while the advocate assists them with signing up with HUD to get into a more permanent long-term housing solution.
Jody, this is Elena. I just want to say, commend you and your team for this work. It's just incredible to hear how amazing the impact that we have in the communities. But your services go beyond addressing a crisis. You are working on educating the communities. You're working on educating the youth about healthy relationships. And something that you mentioned early in your presentation is that we serve men. And that's not very common, right? And I think that's something that, again, Catholic Community Services is ahead of the game. If we look at statistics, 1 out of 7 men experience domestic violence in their lives. And I believe the numbers, maybe 1 in 3, 1 in 4 actually seek help. For us to be one of those shelters, one of those advocates for domestic violence that also includes men, it's quite significant. And I just want to commend you and your team for making that a priority. I think you guys are doing an amazing job.
Yes, we right now have a male victim living in one of the shelters with his children, 4 children. So it was something that we began doing about 9 years ago. And we have had very positive outcomes with the families that reside in shelter during a time where there's a male victim in shelter. And we have had no complaints, I guess. And honestly, it does allow the children to see a positive male role model where they might not had seen that prior. And so it ends up working out for everyone.
Jody, this is Marianne.
Hi,
Obviously, a lot of my questions are going to relate to Cochise County.
Yes.
Or my comments and thoughts are going to relate to Cochise County. But I really appreciate everything you guys do down here. I can speak for many people in the community and say that they know about Forgash, they know about House of Hope, they appreciate what y'all do. A couple questions. Well, a couple comments. Next week, on the 2nd and 3rd of August, a local group of folks are putting on what they call Foster a Future, which is a family support craft fair. And sitting in my garage right now are about 10 backpacks, which will be donated to Catholic Community Services to foster care, family support programs to be used within the shelters anywhere as needed within the county. So we'll be getting those to you. Reference volunteering. People often ask what they can do, how they can volunteer. And I know that that's a challenge because of the confidentiality issues. One of our people who I'm very proud of is Tom Felix. And Tom, through his landscaping company, comes in and cleans the property up at Forgash. But other people would love to come in and play with the kids or whatever. But what actual hands-on volunteer opportunities are there, if there's any?
So there are, Marianne. We do have a volunteer application that has to be completed, and then we do have to follow the process that the diocese has set before us. So all volunteers do have to go through that volunteer process. So that it all starts though with that application. If somebody wants to be a volunteer to work with people or to come to the shelter, inside the shelter, we do need that application process started, and then we will take the ball from there, and then we will educate everyone on how to do the next level of volunteerism, which is that check and balance at the diocese.
Okay, and then my other question is related to actual donations,
Mhm.
physical donations. I know there's and it's been a while since I've been out to our main office in Sierra Vista, but there was a big sign that said no donations. And then on Forgesh itself, there's a sign that says we're not taking donations, and yet I know you need donations. So how do we work around that?
So we got to a point to where we actually had too many donations, if you can believe it or not. And so we did need to kind of put a slowdown on that because we didn't have the space to store them. Now that we have the new module next to Forgash House, that is having shelves put in it. And we are going to be able to start taking those donations again. But we did have it was amazing, but we really had a rush and people were bringing in so many things and we were so fortunate, but we couldn't use them all quick enough. And so we did have to kind of slow that process down. But we are almost to the shelves being built in that new storage building so that we can lift that and then start taking those donations again, because we do really need them and we appreciate them very much.
I would think that one of the things volunteers might be able to help you with is actually sorting through your donations.
That's very good. Yes.
Because I mean, that's not a direct hands-on association with clients, but they would feel like they're really helpful. And then also, I do like the idea of reaching out to community organizations, Rotary, Kiwanis, as an example. And I think your briefing edited to maybe just Cochise County in our case would be very informative within the community. And so we can talk about that.
Yes, I just had a meeting this last week with one of the Rotarians from the Sunrise Rotary Club there in Sierra Vista. And so we are going to be working together on a project for this next year.
And I'm working on somebody that has been very good about helping with raising funds for you folks and raising awareness, and see if we can get her on our.
Sounds great. Thank you.
Okay. And thanks for everything you guys do. Like I said, you guys have a good reputation in the community. And I know that people appreciate what Forgash is about and what House of Hope is about.
Yes. Thank you.
Jody, Tammy in the business office had a question about a list of specific items that you may need at any given time to send announcements out.
Yes. New undergarments. It's the best way to say it. So, like I said, when people come in with only the clothes on their backs, no one wants used undergarments. And so we serve people of all sizes, all gender. So packages of socks, undergarments, sports bras, things of that nature is always something that we need, and always something that goes quick when we do get those donations. And then the other thing that I would say is your personal hygiene items, bottles of shampoo, bottles of lotion, toothpaste, toothbrushes, all of those things, again, go really quick. Imagine how much you go through those things in your own home, and then apply that to if you're serving 30 or 35 people in the shelters. Those things go by really fast.
So I'm sorry, it's Laura again. What's your capacity and turnaround? So I understand volume.
So at the shelter in Yuma, we typically are about 30 to 35 people a day. In Sierra Vista, their numbers are a little bit lower. They are usually in the 15 to 20, 22 a day. And then at House of Hope, I would say between 10 and 15 a day. So it really just depends on, what's going on in the community and whether or not people can exit out quickly to housing. And then our average length of stay has been longer since COVID. So we used to say that we were about 35 to 38 days average length of stay. Now our victim survivor families are staying upwards of 90 days before they're able to exit out into permanent housing or exit out to another housing source. Sometimes people move back to family members or support networks that are not in their community.
Okay, thank you.
You're welcome.
Hi, it's Anna. Great presentation. How are
Thank
you?
I'm great. How are you?
I'm well, thank you. Happy Friday. I'm just curious, since you're so close to the California border, I've seen, maybe I haven't, but I've seen funding for the Southwest. Do you guys get any DV money that includes California money?
No.
I was
No.
just curious.
No, and honestly, there is a DV shelter that is in California, 1 hour from us, but they
In El
do not-
Centro?
Yeah, in El Centro, they do not take Arizona residents. So they prioritize for their community, which I understand because they're limited on space as well.
Yeah. Okay, thank you. I was just curious.
There was a question in the chat. Have you reached out to Save the Children? They support Casalitas with the resources you are mentioning. I would be happy to introduce you to our POC. And that came from a Casalitas person.
Thank you. I have not reached out, so if you would like to send that information, that would be amazing. Thank you.
Thank you.
So Jody, this is Tony Fonzie. I was totally impressed with everything you did today. It was amazing. And the work you do is phenomenal. I was curious, are there any services or available to the abusers to try to get them help? Or is that, I think we're putting our focus where it needs to be. I'm just wondering if anything happens on that side of the problem.
So we do not provide those services to the abusers, but we have referral and resource information so that the abuser can have that information. Oftentimes, our families want to reunite. So they really do want to work with their abuser because their abuser is maybe an amazing father, a great provider. Of course, there's family ties. So we do encourage them to provide that resource to the abuser. It's up to them whether or not they use that option, but there are counseling services at the CCS Yuma counseling office. And we also can, refer outside of that so that families can work together to reunify if that is safe for them to do so.
Okay, well, thank you.
And don't forget, we do enter all of the families we serve into Unitas. So that is another great network for people to have so that even if they leave our program, they still have that connection for those community resources and referrals if they need that.
Well, I really appreciate that. And I thank you and the people in Yuma for being the spearhead of our Unitas effort. You've helped make it happen. So thank you.
We love being pilot program.
Tremendous.
Thank you.
Hi,
Well-
Jody, this is Sam in HR. Can you hear me?
Okay. Yes, I hear you.
So you mentioned Cochise County. So areas such as like Bisbee, St. David, Benson, Alfreda, is word being put out to those communities also in regards to the services that we provide?
Yes. So we are on several task force committees in those smaller communities, and the advocates there go to speak to the sheriff's office, the police departments. we provide information and material anywhere that will let us. We will, drive out our pamphlets and let them know. We are on like the fatality review committees. We're on the domestic violence task force in those communities. So we do go and meet the community whenever they let us. Whenever we hear about an event, we go. I try to go to those communities also at least once a month, and I meet the team in Sierra Vista and Douglas, and then we go and we try to do outreach in those smaller communities.
Thank you.
You're welcome.
What's the relationship like with law enforcement?
It's really good. So this last year in Sierra Vista and Douglas, we really did get a very positive response. And now they are bringing all of the recruits as they're going through the academy, they're bringing them through the shelter so that they see and understand what it is that we have to work with. Yuma, we have had an amazing relationship for many years with the chief of police, and they understand the federal laws and guidelines that we have to adhere to, being a domestic violence shelter and for the safety of the victims and children residing here. But we have great working relationships, and when we need them, they come fast. So they're very, very good to us, and they understand how hard it is for us and also how hard it is for them.
I guess in that Child Protective Services?
We work with Child Protective Services because we are mandated reporters. So if we see something that needs to be reported, then we make those reports to DCS, and DCS will come then into the shelter to interview victims or their families, or go to the schools if that's something that they need to do. But we have great working relationship with the Department of DCS. Some people call CPS still, but yes, we have a great relationship. And even Adult Protective Services, I just wanted to touch on that real quick since DCS was brought up. We often have worked with an elder abuse population. And so sometimes we have someone that comes in that's a vulnerable adult or an elder, and we have had to make those reports to APS to protect that vulnerable adult.
Thank you.
You're welcome. If there's no other questions, I guess I will wrap up and tell everyone thank you so much for giving me your time and learning about the amazing things we do. CCS has an amazing programs, and these programs have longevity. 1983 was 41 years ago, a long time ago. So I want to thank everyone for the work that they do in their programs, and thank us certainly for allowing us to continue to provide the services that we do.
Thank you all for joining.
Bye, everyone.
Bye.